Diabetes is one of the most misunderstood health conditions in the world. Chances are you've heard someone say sugar alone causes it, or that people with diabetes can never eat sweets again. Some even believe diabetes shortens your life no matter what you do. These myths don't just spread confusion, like they can delay diagnosis, discourage treatment, and add unnecessary fear. In the next 15 minutes, we're going to bust the 12 biggest myths about diabetes. We'll break down what's fact, what's fiction, and what really matters if you or a loved one is managing this condition. And I promise some of these will surprise you. Sugar alone causes diabetes. One of the oldest myths is that eating sugar directly causes diabetes. The truth, it's not that simple. Type 1 diabetes is an autoimmune condition where the body's own immune system destroys insulin-producing cells. It has nothing to do with diet or sugar. Type 2 diabetes develops when the body becomes resistant to insulin or doesn't produce enough of it. And this is influenced by many things: genetics, overall diet, physical activity, and yes, sometimes excess sugar. Eating a lot of sugary foods can lead to weight gain and obesity, which raises the risk of type 2 diabetes. But sugar alone is not the villain. Think of it this way: sugar is just one piece of a very big puzzle. Your daily calorie intake, physical activity, stress levels, and family history are equally important. So while it's smart to limit soda and sweets, saying sugar alone causes diabetes oversimplifies a very complex condition. People with diabetes can never eat sweets. Another myth says that once you're diagnosed, desserts are gone forever. That's simply not true. People with diabetes can enjoy sweets, but it's all about moderation and timing. Instead of eating a giant slice of cake on an empty stomach, a small portion eaten after a balanced meal, one that includes fiber, protein, and healthy fats, can have a much smaller impact on blood sugar. Modern diabetes management isn't about strict deprivation. Tools like carb counting, insulin adjustments, and continuous glucose monitoring allow people to fit occasional treats into their lifestyle safely. In fact, completely banning sweets can backfire, causing frustration and binging. The real key isn't avoiding sweets forever. It's learning how to balance them responsibly in the bigger picture of a healthy diet. Only overweight people get diabetes. Obesity is a major risk factor for type 2 diabetes, but it's not the only one. Many people of normal weight and even underweight individuals can develop diabetes. Type 1 diabetes is unrelated to body weight altogether. For type 2, factors like family history, ethnicity, age, and even fat distribution matter more than just body size. Visceral fat, the fat stored deep around abdominal organs, plays a big role in insulin resistance. That means someone with a normal BMI but high belly fat may be at greater risk than someone heavier, but with more balanced fat distribution. So while being overweight does increase risk, it's a myth that only overweight people get diabetes. This misconception is dangerous because it can make lean people ignore symptoms or delay testing, thinking they're safe. In reality, diabetes can affect anyone. Type 1 and type 2 are the same. Despite sharing the name diabetes and the common symptom of high blood sugar, type 1 and type 2 diabetes are very different conditions. Type 1 is autoimmune. The body's immune system mistakenly destroys insulin-producing cells, leaving patients dependent on insulin for survival. It often develops in childhood or adolescence, though adults can get it too. Type 2. Diabetes, on the other hand, develops gradually when cells become resistant to insulin. Lifestyle, diet, and genetics play a huge role here. In the early stages, it can sometimes be managed with lifestyle changes or tablets, though insulin may be needed later. Confusing the two is not just inaccurate, it can lead to stigma and misinformation about treatment. Understanding the difference is key to managing both properly. People with diabetes should avoid exercise. Some people still believe that exercise is risky for diabetics. In reality, physical activity is one of the most powerful tools for managing blood sugar. When you move your muscles, and whether it's walking, cycling, yoga, or lifting weights, your body uses glucose more efficiently. This lowers blood sugar naturally and improves insulin sensitivity. Yes, planning is important. People taking insulin may need to adjust doses or have a small snack before intense activity to prevent hypoglycemia. But avoiding exercise altogether deprives you of its enormous benefits, not just for diabetes, but for heart health, weight control, and mental well being. So instead of skipping workouts, the goal is learning how to exercise safely and consistently. Insulin means you failed. Here's a myth that hurts people emotionally, that needing insulin means you failed. That's completely false. Diabetes, especially type 2, is progressive. Over time, the pancreas simply produces less insulin, regardless of lifestyle. Needing insulin doesn't mean you didn't try hard enough. It means your body needs extra help. For type 1 diabetes, insulin is essential from the very beginning. For type 2, starting insulin is often the best way to prevent complications like kidney disease, nerve damage, or vision loss. Think of insulin as a tool, not a punishment. It's there to help you live longer and healthier. Diabetes medications damage organs. Some people believe diabetes medications damage the kidneys or liver. This myth comes from confusion, because organ problems often appear around the time medications are started. But here's the truth. Uncontrolled diabetes is what damages organs, not the medicines. High blood sugar over time injures blood vessels, nerves, kidneys, and eyes. Drugs like metformin, sulfonylureas, and insulin actually help prevent that damage by lowering glucose levels. Side effects exist, but they're generally mild and far outweighed by the benefits. Instead of fearing medications, we should see them for what they are: powerful tools that protect long-term health. Once controlled, diabetes is cured. Some people believe diabetes disappears once blood sugar levels return to normal. Unfortunately, diabetes has no permanent cure. It can go into remission, especially type 2 after lifestyle changes or bariatric surgery, but the risk always remains. That's why monitoring and healthy habits must continue, even if sugars look normal. Stopping treatment too soon can undo years of progress. Think of diabetes like a garden. You can control the weeds with effort, but if you stop taking care of it, the weeds will grow back. Long-term management is the real goal. Fruit is too sugary. Fruit often gets unfairly labeled as too sugary for people with diabetes. But unlike candy or soda, fruits come packaged with fiber, vitamins, minerals, and antioxidants. The fiber slows digestion, preventing rapid blood sugar spikes. Whole fruits like apples, pears, and berries are excellent choices. The real culprits are fruit juices and dried fruits, which concentrate sugar and remove fiber. So the key isn't avoiding fruit, it's choosing whole fruits in the right portions. Cutting them out completely only deprives the body of essential nutrients. Diabetes ruins your life. One of the most damaging myths is that diabetes destroys your quality of life. The truth is, millions of people live long, active, and successful lives with this condition. With the right treatments, modern technology like continuous glucose monitors, and healthy lifestyle choices, diabetes can be managed effectively. From professional athletes to entrepreneurs to everyday parents, people with diabetes excel in every field. The real difference is awareness and self-management. Diabetes doesn't mean life stops. It means life requires a bit more planning, and that's something anyone can learn. Stress doesn't affect diabetes. Here's a myth that gets overlooked. Stress doesn't affect diabetes. In fact, stress plays a huge role in blood sugar levels. When you're stressed, physically or emotionally, your body releases hormones like cortisol and adrenaline. These hormones increase blood sugar to give you energy for fight or flight. Chronic stress makes it harder to control diabetes and worsens insulin resistance. That's why stress management, through exercise, mindfulness, hobbies, or better sleep, is an essential part of diabetes care. It's not just about what you eat or the pills you take. It's also about your mental well-being. Diabetes always shortens your life. Another myth says diabetes inevitably cuts your life short. This may have been true decades ago, but not anymore. Today, with early diagnosis, modern medicines, and proactive care, people with diabetes can live just as long as those without it. The key is management. Uncontrolled diabetes increases the risk of heart disease, kidney failure, and nerve damage, which can reduce lifespan. But controlled diabetes dramatically lowers these risks. In other words, the future is in your hands. With the right care, diabetes is a condition you live with, not one you die from. So there you have it. The top 12 myths about diabetes, busted with science. Sugar alone doesn't cause it. Insulin isn't failure, and yes, you can live a long, healthy life with the condition. The more we replace myths with facts, the more empowered we become. If this video gave you clarity, hit like, share it with someone who needs to hear this, and subscribe for more health guides. And in our next video, we'll uncover diabetes complications you can prevent. Because knowing the risks early is the first step to avoiding them. Don't miss it.